One major key obstacle is the lack of standardization. As I mentioned, Hackensack Meridian Health came together as many hospitals. We have over 10 hospitals. We have over 7,000 providers. Everyone's been doing their thing in their own way historically for years and years. Now, as we are working as a system, it is, as we know, change is hard, and not everyone is accommodating. Our provider network has employed providers, affiliate providers, some providers who, have special legacy contracts, and so we can't always, kind of force everyone to standardize the way we want to. So that is definitely challenging, just making sure that everyone is using our tools in the same way, communicating in the same way. Another thing that's challenging is, of course, just the number of vendors in the ecosystem. I mean, we've got the EMR, of which, we have Epic. Epic has lots of different tools. We've got, the ED and Cadence and Optime and all these other modules within Epic. We also have Find a Doctor. We have, our online live chat. We have our CRM system. We just have so many different ways that we're getting messages out to patients. How do we get the view of that and make sure that we're not like stepping over each other to be ineffective in our messaging?
And building off what Amy's saying, you have vendors that can do A, B, C, and D, vendors that can do B, C, D, and E. So how are we building the most effective full stack solution where we're taking advantage of investments in enterprise platforms that we're already definitely going to use, minimizing points of failure, taking advantage of best of breed technology where appropriate. And then, on the operational side, right, we have access centers that grew up really, really great in healthcare and operations. But as we grow to more of this like formal kind of contact center operation, how are we evolving? How are we, improving quality assurance, performance metrics? It's complex for sure.
Yes. Yep. So for us, simplicity for the patients and staff was key. We really wanted it to be user-friendly, and we wanted them to be able to schedule off our website and it actually looked like it was our website, not ZocDoc. And then bi-directional texting communication. Our patients are very needy. They're pain patients, so it's a little bit different demographic. They want a person and they want an answer now. So we really focused on the online scheduling and text messaging to start. As you can see from the data over the last 2 years, we've had a 29% decrease in incoming phone calls, which allowed us to decrease our full-time employees by 5. And then we've also had a 296% increase in automated text messages. On average, we send about 8,000 manual text messages a month responding to those patients. And then with the Block It, we just recently implemented that at the beginning of September. We've already had a 45% increase in online scheduling, which is amazing. ZocDoc was not very user-friendly. Our doctors also did not care for it. So this has been great. And then we're still in the process of implementing Health iPass, but we're hoping that at least gives us a 10% reduction in wait times.
So big impacts in the before and after as you've entered the journey here.
So when we started, we wanted to keep it simple too. We are rural health and our providers go a lot of different places within our communities. We wanted our patients to get there, we wanted them to be on time, and we wanted them to the right location. We also, where we're rural health, we wanted the numbers going out that these patients are receiving the messages from. Like, we want patients to know that's us. So it was really important for patients to know that that number that it was coming from was from Uinta Basin Healthcare, and that they were going to show up at the right facility to see these providers.
That's great. And so you've seen a lot of results there that I think getting people to the right locations and making sure that they're on time for results has been great. Amy, any thoughts on some of the progress and results that you've had in your journey?
Yeah, absolutely. I mean, we're doing, I mentioned 10 million appointment reminders a year, and we are continuing to add to that. In addition to that, we're doing mammography, care gap closure programs where we're sending out messages for women overdue for their mammo. Pam mentioned that in her previous talk and mentioned the 2.7 million. We sent out, I want to say $2.7 million in incremental revenue, and that was from only a 5 to 6 month period last year. That was, we texted about 48,000 patients. From that, we got about 6,000 appointments, and that led to that 2.7 million in incremental revenue. Just for that, it was May to September of last year. We were able to see that downstream. And also, more importantly, there's a 2% positive on a lot of those mammograms that came back. So those women who may have missed that, got that news and got into treatment, and we helped them identify that. One other sort of anecdotal, I don't have numbers on it, but we have integrated our Optime, which is Epic's surgery module. So we send family messages when a patient is in surgery. We send them updates, of when they're going into surgery, how they're progressing, when we expect them to come out, et cetera. That's all done through Epic, but we run those messages. We had been doing them via email. We now run those messages through Artera, through SMS. And from that, we have found, looking at our Harmony dashboard, which we may talk about a bit more later, but there's one of those pieces where we were kind of stepping on each other. There was some overlap. Some patients were getting an appointment reminder for surgery, and some patients were also getting a message from Optime for their upcoming surgery. And that was causing a lot of confusion around patients. And we had, no awareness of that really until we really started digging in and looking at these multiple messages. So we were able to resolve that. And it's just one of those small things that will make a big difference to patients. If they feel like the right hand isn't talking to the left hand, that's not going to build confidence in your healthcare system. So we were able to resolve that, and we continue to look for issues like that.
Looking at people, process, technology, and methodology across the patient experience life cycle or the customer experience life cycle. So everything a patient is leveraging to interact with a healthcare provider throughout the continuum of care, across specialty, cross department, developing that understanding of what that looks like today and what these stakeholders want it to look like in the future, I think is a crucial step. So think big, but start small, right? So, have an understanding of what the forest looks like, but that doesn't mean we have to boil the ocean. So yeah, I think that's one thing. I think one thing that was mentioned too is by Pam actually, from a customer experience standpoint, starting with the customer journey or the customer intent in mind. So how can I ingest all my patient correspondence at scale to better understand intent and the actual things patients want to accomplish, and actually build out, instead of just recreating workflows that we've propagated for many years, how can I create new? How can I throw it up against the wall and really see how patients want to navigate the health system and leverage things like generative AI to get there quicker versus intent-based workflows that just look like spaghetti.
Mm-hmm. We all know the patient journey is not linear and clean. It can be bouncing all over the place and very unpredictable in many cases. So we started using the Harmony dashboard. I think it was late last year, probably. And we are just regularly looking at that and regularly looking at what patients are getting too many texts from us, really. Currently, we have integrated into Harmony our, I mentioned the Epic Optime. We have, of course, our appointment reminders. We have our care gap closure, any campaigns that we run in those areas. We also recently just implemented something with our pharmacy team. It was a partnership with Dr. First and Artera, so that when patients get a prescription, they'll get a text. Basically, Dr. First does real-time benefits authorization, and will send the patient information about, where they pick up their prescription, any education about that prescription, et cetera. So those messages are also feeding into our Harmony. And we have many more items to come. But looking at those, maybe once a week or every couple of weeks, we run a report and we say, okay, who's getting too high volume of texts, and just really digging in and looking at what those are. Sometimes it's as simple as, working with another team, like I mentioned with the op-time surgery patients, and say, okay, we're going to cut off this message. We no longer need to be sending that because it's being taken care of through another system. And sometimes it's just our own messaging. We have, this is a pretty simple thing, but we have merged messaging for instant book appointments, because we see that many patients, whether they're going for their allergy shots or they have a behavioral health or physical therapy or whatever it may be, they may be booking appointments out, 6 weeks, 8 weeks, et cetera, all at one time. And we're hitting them with, 6, 8, 12 messages saying, thanks for booking your appointment, thanks for booking your appointment. And that's absurd. So we learned to really, address that and cut that off. And we've just found it really helpful to look for other trends like that. Sometimes high message volume is great and expected, because it may be they're texting, bi-directional with someone from our patient access center to schedule or reschedule an appointment. So it's not always a bad thing. Sometimes it's intentional, but we definitely want to find out where those issues are and get those addressed.
Thank you. And anyone else in terms of best practices, what's worked well? What's worked well in making a positive impact for the patient experience and the staff experience?
Mm-hmm.
I would just add maybe some of the newer technologies that have become available that, in some instances you can take advantage through enterprise platforms that you're already, leveraging, and then in other cases are being made available through, partners like Artera, some of the newer cloud contact center vendors, but, things we can do with, auto summarization, things we can do with, screen pop and personalization. Basically, like, how am I making it so that my access representatives can focus on being there with the patient while they're on the phone with the patient, instead of thinking about the next thing they have to do. So natural language processing over the course of the conversation, feeding next best action, all things that are now possible. So it's exciting.
Yeah, very exciting.
And I'll add also the consistency of message, and making sure that everything is branded and the same, not just branded, but you're speaking with a common voice, a consistent voice from the network. We have, I mentioned the op-time messages we're sending through Epic, or from Epic through Artera. We're also currently working on adding more, including messages for our cath lab patients, so updates to the family there, and also for our emergency department. So, when patients are in the emergency department, we can let them know, we're prepping your room, so stay in the area. We say, if you need to use a restroom, we're going to need a sample, so just hold off until, we get back to you if you can. So all of these messages used to be, a person, a clinician or someone going back and forth, running through all these rooms, communicating these simple messages to patients that really don't, many do need to be face-to-face, but not all messages need to be face-to-face. So we're really, making sure that our clinicians we're using them what they're doing, what they should be doing, and not just running around communicating with patients. So we're building efficiency there too.
That's excellent. Let's I love this next slide. It's a lot of logos. But this is also the community that we have here in the room. And this is the community where, as we talk about best practices and impacts that we've been able to have on making that experience for the staff and for the patient more seamless, this is how we learn together. See what's working, see what's not, continue to adopt and use and technology and the change management that we're learning together. Question for the panelists, and I'll just open it up to the group. Any struggles that you'd want to share with the group, or areas where you're really trying to learn? And we want to start discussion that'll hopefully move into the lunch hour. What topics would you love to throw out there to really start discussion? We'll also have a Q&A right after this, so you can get some immediate feedback. But anyone want to jump in?
One of our biggest struggles is patient engagement. We started sending our text messages from Artera, and we also partnered with Tonic. So patients are getting this. We want them to fill out the forms before they come, but not everybody is. We are trying to make it as seamless as possible for the patients, but just trying to get them engaged has been difficult.
Mm-hmm.
Engagement by patients, filling out, taking the next steps, absolutely.
Yeah, I think our biggest struggle is figuring out how to roll out Artera to the entire company. We initially did it and ended up with quite a few HIPAA violations, so we rolled it back to just our patient access group. So really looking at ways to do that to where it's secure and we're not sending inaccurate information or not replying back to patients.
Yeah, managing. Yeah, and there's a lot of operational change management as well as working with the platform there for sure.
Mm-hmm. Yeah, I'll say from my perspective at Hackensack Meridian Health, it's a really large network. We serve a lot of patients, and something that a challenge that I've had, which Emily knows, I've talked to her about it many times. How do we create these communications and make sure that these messages are relevant to the specific scenario for the patient, whether it's a specific kind of appointment that's maybe non-standard in some way, or whatever it may be, and yet scale that out to millions of messages. We have hundreds of different departments, and while we are getting there, I talked about standardization. We're getting there, but we're still, some departments don't schedule. They have a certain way that they have to schedule, and another department has this other certain way they have to schedule. And while we do have a patient access center, which is growing and growing, and we love that because that helps so much with standardization. But for those cases where it's not a standard message, how do we keep that centralized and keep an eye on everything when it's just so large in scope and scale?
That can be too where we see CRM and system of interaction, because you can't always manipulate the data the way you want to get that level of personalization in your EHR. And I think that leads into one of the challenges that we see, which is how am I measuring the efficacy of where I'm going to have these different features and functionality live? Like, I'm going to have it live in my EHR, I'm going to have it live in my CRM, I'm going to have it live in my CCAS, I'm going to have it live in Artera. How are we empirically validating what makes sense and what doesn't? That's, it's very challenging. And then couple that with the operational challenges of, building a unified access center, right? Unified doesn't mean like you're losing your personality, you're losing your specialization. Like, we can maintain that, but actually going out and enrolling people in that, like we're seeing Common Spirit do that right now, just like literally like making the trip, shaking the hands, like, and in my experience, like that's often what it takes is really, and how can I help folks arrive at the place that, because we usually have a very similar vision, so how can we talk that different language and kind of put our arms around people and get them there?
I think we have some common organizational industry challenges to take on. I heard helping patients take the next step and using data to understand the baseline to be able to drive that. Scaling of different sorts, whether it's our staff or to patients, and making it feel intuitive, bringing together all the different systems, those core systems that and vendor partners that are already in place to bring that experience together, which is the theme of the panel. So big challenges for us all to take on. So thank you.